Well, I would say get involved with us because, again, as in dentistry, we don't do it anywhere else. Doctors just want to do doctor. They don't want to do anything else. We've figured it all out, and they don't have to. They don't have to figure out anything. We are a complete and total safety net. They basically just get in touch with us. They can either go to UnitedDentalCoop.com to our website. They can email me directly at Tammy, Tami, at UnitedDentalCoop.com. They can reach us on Facebook. We are on just about every platform that there is out there. And the nice thing about what we're doing with United Dental Co-op with physicians is anytime there's something big in dentistry, always the first thing is how much? How much? Because it's big dollars. They want big dollars. That's not what we do. That is not at all what we are doing here. We won't even ask for initial investments. Like, this is something that we can start these physicians on.
Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential.
Hey everyone, and welcome to the American Potential Podcast. I'm your host, David Fromm. If you've been listening to this podcast for a while, you've probably heard us talk about something called direct primary care, which is where patients and their healthcare providers make decisions together without insurance companies getting in the way. This idea has been around for a while, and a few years back, someone who works in a dental office heard about this concept and started wondering, could the same idea work for dentistry? She and her husband, who happens to be a dentist, decided to give it a try. After trial and error, they developed a direct dental care plan that's now helping their patients save money in the long run. I want to welcome to the podcast Tamara Stillwell, who's the office manager and a registered dental assistant for Athens Dental Center and United Dental Co-op. Tammy, welcome.
Hi, thank you. How are you?
I'm well. Thanks so much for joining us and talking about what you guys have done. So just to get started, first of all, where are you based out of? Where are you coming to us from?
So we're in Athens, Tennessee. So we're smack between Knoxville and Chattanooga.
Oh, awesome. What a beautiful place. And gosh, what a hot state. I know I'm based outside of Chicago, and I feel like every third person is moving down to your state.
Well, that's actually where the dentist is from originally, is he was born in Chicago. We still have family up there.
Nice. So you got a good man. There you go.
Absolutely. The best.
Nice. So, you originally worked with your husband for a while dealing with insurance. What were some of the issues that you saw for your patients and for the dentist?
Well, for 20 years, we were fee for service. Accepted dental insurance, meaning that we were not in network with any insurance company, but we would take anything that pays. It was the common things back then as it is now. Very little money is given to dentistry, to be quite honest with you. Most maximums are between $1,000 and $1,500 per year, which even 20 years ago didn't really get you very far. But we were dealing with the same things that the medical providers deal with: denials, delays, losing claims, taking 6 months to get payment, paying very little, patients ending up with really huge bills, and it just got to the point to where doctor wasn't getting paid to do any work. The patients certainly weren't getting any care for their premiums, and the insurance companies were making out like bandits.
Yeah, it sounds like unfortunately a familiar story.
Yeah.
I am very, very painfully aware of those low annual maximums, because I feel like we hit them every single year, and it's like, oh man. I feel like everybody says, oh, no one has really great dental insurance. So I'm really excited that you guys have kind of forged some new ground here. Yeah. So where did you originally hear about direct primary care?
Well, oddly enough, we've been doing this 9 years now. So it was probably 10 or 11 years ago. We were watching Sean Hannity. We watched it, every night. And there was a physician that had been on there several times. I believe his name is Josh Umber. Hopefully I didn't mispronounce his name. But they kind of started the direct primary care model way back when, and it started out in Wichita, Kansas. Well, the doctor basically tells me about it, and me being the internet stalker that I am, I run the guy down, literally. And I gave him a call and said, look, we really love what you are doing in the medical field. And we want to figure out how to do this in dentistry. And he said, wonderful. How can I help? And it just kind of, went from there. It took a bit more to do this in dentistry, probably about 6 or 7 months. It took Dr. Stillwell to just try to find some way to even make it work, because it's a little different in dentistry than in primary care. We do microsurgery all day long. So it's a little different, and we had to figure out how to make that work, be profitable for the offices, and still benefit for the patient. So it took a little bit to initially get it out.
So just taking a step back for folks who maybe haven't listened to our episodes previously on direct primary care, can you just give me a quick rundown as to what direct primary care is?
So in general?
Yeah.
Okay. So in general, direct primary care is basically a contract, if you will, between you and your physician, not your physician and the insurance and your insurance and you. We've cut out the middleman completely. And what ends up happening with this is, because we take insurance out of it, it actually lowers everybody's overhead. It is terribly expensive to file insurance and then refile insurance and then fight insurance to get a few pennies of insurance. And if they deny, the patient can't get the care at all. So when we take them completely out of it, this now comes back to what it used to be. Back in the 50s and 60s, we didn't have this kind of thing. You only had insurance for hospitalization. You didn't have it for every day. So when you needed to see your doctor, you made an appointment, you went and saw your doctor, you paid for your visit, and it was a done deal. We're getting back to that model because insurance has actually been the cause a lot of why all medical care, medical, dental, all of it has become so terribly expensive. It is a billion-dollar business for these insurance companies. Billions annually. There's a reason they're making a lot of money, and we have a lot of people that still don't have any quality of care at all. So that's a problem.
Yeah. So I think, cutting out the middleman makes all the sense in the world, especially when the middleman doesn't necessarily have the patient's best interest at heart. So we're kind of aligning incentives more. The provider wants to provide good care and help somebody with their malady. The person who's experiencing an illness or needs dental work, wants to get that fixed at the best price possible. So it feels like bringing together the interested parties here without a third party makes all the sense.
Yeah, it's kind of a big deal because your physicians also are the ones that are on the line, right? So you have to look at, regardless of insurance, what your physician does or does not do for you, he is liable for. And I mean that legally liable for. So if you have an insurance company that is tying that doctor's hands, and it is a little different in medical versus dental because everybody in medical is signed up to insurance, kind of have to be. Dental, there's still a little more option. If that insurance company tells that physician he's not allowed to do that, he's not allowed to do that. He can be sued for it, but the insurance company can't. So now there's an ethical issue that comes into play. The doctor is not able, a lot of times, to give the care they're wanting to do unless they're willing to do it completely for free. Because that's the stipulation with the insurance companies. It is a messed up thing. If a patient needs something and the doctor says, I can do that for you, they should be able to just do it. Here's basically what it's going to cost. That's exactly what they should be able to do. Insurance should be a credit card, nothing more. Your diagnosis has nothing to do with your insurance coverage. You need what you need. You should be able to get that if you're paying somebody for it. And with direct primary care, you're paying that physician directly instead of an insurance company, which means now you don't have any deductibles. You don't have any annual maximums. Generally, the copays are very small. And in our instance, if you meet your contractual obligations, you'll never see a bill. It's about as simple can be. And it's affordable, really affordable. It costs about the same amount as it does for an insurance policy. Some cases it's less.
Wow. So tell me about how it works. I know you guys have had some trial and error starting out. Maybe talk to me about what you learned along the way, and then just kind of how your system works.
Well, for us, our system, it did. It took a lot of trial and error. I think we're 9th year in, and we've made all the mistakes that could possibly be made. This is uncharted territory, especially in dentistry, completely uncharted territory. So we kind of learned the hard way. Things would happen. We go, oh, okay, can't do that. Let's fix that one. All right, let's do this. And we got it figured out. So in general, it works 2 different ways. For the physicians that basically decide they want to use this model with us, we've figured it all out. We've taken care of everything. We have all the contracts that they basically need. We have everything set up for membership. We have training. We have everything that's basically provided, even social media for them if that's what they want and need. We handle just their memberships. We don't handle any in-office care at all. This is where it gets really different. Any office that joins in with United Dental Co-op keeps full autonomy of their office. We have nothing to do with how you run your practice, when you run your practice, what you set your fees for, nothing. We help you set your membership fee, and then we manage that membership fee for you. Everything else is basically done in that office. So the physicians get a predictable monthly income. They know they're going to get it, and this is before they've ever rendered any treatment whatsoever. So that takes a lot of stress off of the physician and off of his hygiene office. We can lower their overhead extremely because they're no longer going to have to file insurance. They'll kind of migrate their way in, but the point is to get to not have to take insurance anymore. I don't think a lot of people realize that medical offices and dental offices have staff members. Their entire job is to do nothing but advocate for their patient and run down insurance companies. We won't have to do that anymore. So that absolutely lowers their overhead. For patients, they get the huge deal of no annual maximums, no deductibles, no denials. If we can render the service, it's covered, and if we can't, then it's not. Sometimes we have to refer. There aren't any specialties that are under a co-op because we haven't figured out a way to make that work just yet. But it's no different than it would be with insurance. If they have to refer, they're still going to have to pay an outside entity. It's just everything that we do under the co-op is a covered thing. Basically, the patients have a small copay for any preventive, which is generally around $2. They have like a 10% copay for basic procedures and a 25% copay for major procedures. This thing is set up to incentivize the patients to do the right thing, do your work when you need to have it done, and to stay on your recares because we've made it affordable to where they can actually do that. For the doctors, this is contractually obligated for the patient. That's our safety net, if you will. So that, in all honesty, I say this to my patients, so that you can't come in and get 20 grand worth of work done and then dip out and go. This is meant to be a long-term commitment between you and your provider, and it's set up that way. And it is absolutely beneficial to both parties as long as everybody plays the game.
Yeah, that sounds great. I'd like to look into it. What do you hear from your patients? So because you guys have been doing it now for a little bit, and with regard to this setup, like what do they have to say?
Oh, they love it. I mean, I have patients that have been with us since day one. We're almost 30 years in. So we have patients that know exactly how our office ran when we were fee-for-service accepting their insurance, and then jumped into the co-op as soon as we offered it, and can absolutely see the difference between the two. My office is still ran exactly the way that it was ran when I was fee-for-service. I still offer the same procedures that we did. They know the treatment is the same because they have A and B to look at, right? They absolutely know, except for now, they don't have to worry Is the insurance going to deny this? Do I have enough insurance benefit left? Am I going to get a bill after? It literally takes the stress completely and totally out of it because they know they don't have to worry. As long as I can do whatever needs to be done, you have this copay, you're golden. It really doesn't get any simpler than that. And it lowers the cost expectation. Kind of my joke is there's a reason I can do a filling for $27.
Wow.
That's their copay. $27 for a small filling. My people have, I think, a crown is like $1,700. My patient's copay is $580. That's their 25% plus lab fees. You're not going to get that with insurance, ever.
Nope.
But if they need the crown, they need the crown. And I don't want to have to ask somebody's permission that isn't a doctor and not their doctor. They're not treating them. Can I do this procedure? The patient needs it. Do you want the crown? Yes, I do. Fantastic. Let's schedule it. That's as far as it should ever go for anything as far as the field is concerned, medical or dental. It's working very, very well in dentistry. I guess the hardest part is probably medical had the same thing, is just trying to get people to understand it's not a scam. We've been doing this a long time. It works, but it takes everyone playing the game, and we are very forward about how the program works with the patient so that they fully understand, because it is contractually obligated. And we feel that, we should be doing that, right? We should explain to them exactly what the contract means to them if they were to breach it before, not after, so that they can make the best decision for themselves on what they think would work.
So, well, I'll tell you, I have some family and friends who are in medical co-ops, not dental one. Obviously, it's rarer. And they're the best advocates for it because they love it, And one of our doctors, who it's been our family doctors, switched to a similar model, and so we're just starting to get to it, and it's been fun, and I've liked it a lot, and I think he just feels like you almost see the change in him. He loves it.
Yeah, it's a completely different level of care. I'm a member of a direct primary care here in the local area. I don't have insurance of any way, shape, or form, not even catastrophic. I have a MedShare type thing that I got through my direct primary care, and I get discounts because I purchased through that. So I'm covered every which way, but loose. And, it cost me like $79 a month, and my medication's even included. So, I mean, I don't know why anyone would ever want to do any standard of care. They recently just hired a physician's assistant that I've used for 20 plus odd years. I followed him everywhere he went. Literally said, I will never, ever work under traditional insurance again. He said, if I'm not doing a direct primary care, I don't want a physician anymore unless it's under this model, because he's free to treat his patients, which was the whole reason they become doctors, is to help their patients. We don't need somebody in the background going, yeah, but you can't do it. No, we don't want you doing that. No, you can't do that. They should be able to treat the patient. They're fantastic. I wish everyone would move to these models. Everything would start costing a whole lot less doing it that way.
Yeah, I mean, healthcare's, we wonder for healthcare in America, of course. But the system seems broken. It's not really working for the patients and for a lot of doctors.
I've always said we don't have a healthcare problem in this country at all. We have an insurance problem. Healthcare isn't the issue. Our healthcare is second to none in the world. That's why everyone wants to come here for their healthcare. We don't have a healthcare problem. We have an insurance problem. They have gotten so out of hand and have gotten away with these things for so long, they feel they're untouchable. We've been doing this for a little bit, but you've noticed just over the last 12 months, how much of that curtain is now being opened, where physicians are openly talking about how we are getting screwed on a daily basis by insurance companies. I think Dr. Potter is the one that went viral. They literally pulled the woman out of surgery to talk about the patient she was doing surgery on. That's insane.
That is crazy.
Just insane. So, I think now is the time, strike while the iron's hot, if you will, kind of thing, for people to really start looking into this. And in dentistry, we absolutely need it. I mean, we are a separate entity, absolutely, from medical, and we meant to be that way.
Yeah.
But we need some help, because I'm telling you, dentists are drowning. Patients are not getting the care that they need to get. And we just knew that there had to be a better way, and we found it. It's just, all right, now we got to get it out. Patients understand it. Now I got to get it out to dentists, to get the dentist to understand. You don't need to take insurance. You don't need to be in network. You can basically run your office the way you want to and still make enough money to pay all your bills, do all the things you need to do, take some time off, all those things, and help the patient save money at the same time. It can be done.
I would imagine that more dentists adopting this model is the main way you would like to see this grow, and more, obviously, more patients opting in. Just general, how would you like to see this progress? What ideas do you have there?
So this is the thing. We just started this year really pushing the actual United Dental Co-op model out there to physicians. We've been doing this with patients for a long time. I mean, that I kind of got in my back pocket. Trying to get this out to the physicians is the big thing. We've got to change a lot of minds out there right now. So anywhere where I can talk about this platform and get it out there, there's a few places, because I've had some go, oh, I've seen dental co-ops before. No, there have been a couple of places where they will do preventive measures only, like cleanings. And how they would do that is it cost X number of dollars for their cleanings twice a year or 3 times a year, whatever it is that they have them set up on. They would charge them full fee for that, but they will allow the patient to pay a monthly payment over 12 months. That isn't saving the patient any money. It isn't incentivizing them to come in and get the work done, really do that. And it was just on preventive. We are the first ever full-in dental co-op. We do crowns, bridges, dentures, partials, fillings, you name it. For the most part, we do it. We do all of those things are covered under our co-op. We need to show dentists that there is a way to do this without insurance. For some reason, and it's only dentists that think this way. We jokingly go, do you want to work this much for this much money? Or do you want to work this much for this much money? And a dentist will go, I don't know. Just them. Just them. Nobody else does it. Just them. And it's like, geez, guys, do you want to render the care and not work like a plumber? I mean, that's kind of, you became a doctor to basically do good in the world, right? And not work your guts out. It doesn't happen anywhere else but in dentistry, and dentists get burned out quicker than any doctor. In any other, it is the absolute truth. The statistics for burnout, I hate to mention suicide, all of it. It is the highest in dentistry.
Really?
Yes.
I would not have.
Absolutely.
I would not have guessed
that. Do a dive. That's a rabbit hole you probably don't want to go down. But yeah, anything that we can do to try and lessen the stress. Because again, dentists, we do microsurgery all day long. So we do all the surgeries, but we're doing it in millimeters in little 2-inch square, spaces with people that absolutely do not want to be where they are at that point in time. So any way that we can make it easier for everyone involved, this is kind of the start of people's health. If you are unhealthy here, you tend to be unhealthy everywhere else. So it's really important that we start getting this part healthy so that we can make it easier for all the other physicians to keep the rest of you healthy as well.
Yeah, I think that's so true. That's so true. You hear about the incredible links even between health in your mouth and the rest of your being. So as we look to wrap up, what advice would you have for someone who listened to this, is really excited about what you guys are doing, and wants to either start it on their own or get involved in some way?
Well, I would say get involved with us because, again, as in dentistry, we don't do it anywhere else. Doctors just want to do doctor. They don't want to do anything else.
Mm-hmm.
We've figured it all out, and they don't have to. They don't have to figure out anything. We are a complete and total safety net. They basically just get in touch with us. They can either go to uniteddentalcoop.com to our website. They can email me directly at Tammy, Tami, at uniteddentalcoop.com. They can reach us on Facebook. We are on just about every platform that there is out there. And the nice thing about what we're doing with the United Dental Co-op with physicians is anytime there's something big in dentistry, always the first thing is how much? How much? Because it's big dollars. They want big dollars. That's not what we do. That is not at all what we are doing here. We won't even ask for initial investments. Like, this is something that we can start these physicians on, and it won't cost them a penny to do it. Like, that's unheard of in dentistry. We have everything completely filled out. All they have to do is sell the membership to their patient, and we're going to show them how to do that. They don't have to do anything else because we've managed it all. We've figured it all out. Worst case scenario, if things go haywire, we even have a backup set up for that as well at collection agencies in every state in the United States. So we've made it easy to where they don't have to figure out anything. All they have to do is sell the membership model, work their way out of dental insurance, and we pretty much got their back on that. So you really can't get any easier, and us not asking you for $10,000 or $15,000 to boot.
Yeah. Well, no, that sounds great. It's really what I love about this. It's so quintessentially American because it really is a form of innovation. I mean, taking something that's happening somewhere else and applying it to your business, your situation, your geography, whatever it is really what innovation is. You know, it's sometimes we think it's just coming up with something in a thin air. It's not. It's taking what other good things that are happening and applying them to get great results. And it sounds like that's what you're doing.
Well, I've always said, if there's an issue out there, if you'll just get out of our way, the market will figure out a way to fix it. I mean, especially in America, that's kind of the thing. If there's a big problem and people know the problem is there, we'll figure out how to fix it. You just got to get out of our way enough to let us do it. So, this is the future in not only medical care, but dental care as well. And it's a bright future. So we're hoping to get as many people involved as we can to show them the freedom that is allowed to not only the physician, but also to your patient. And that is, it's worth no amount of money that you could possibly give.
Well, it's great. It's a great story. I wish you guys all the success in the world, and I hope it just continues to grow. So thanks for joining us and telling us about it.
Thank you so much for having us.
Yeah. Well, folks, if you like this episode and would like to stay connected with the podcast, be sure to like and subscribe to our channel, as well as following us on Facebook, Instagram, and YouTube. And always remember, liberty and freedom are easily taken for granted. Don't take it for granted. Go out there and defend freedom and liberty. Thanks for joining us, and we'll see you on the next episode.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.